As we look around the world in May 2025, the COVID-19 pandemic continues to shape public health landscapes and government decision-making on a global scale. While the acute shock of the early pandemic years has subsided, the virus itself remains a dynamic threat, reminding us that the story of COVID-19 is one of ongoing evolution and adaptation. Each new variant, each policy update, and each treatment advance represents a collective effort to stay one step ahead in a prolonged and challenging public health journey. Recently, virologists and epidemiologists have turned their attention to a new variant, designated NB.1.8.1, that first emerged in the United States. This variant was initially detected via the Centers for Disease Control and Prevention's robust airport screening program, which examines international travelers for new and emerging strains. Scientists believe that NB.1.8.1 is linked to a recent surge of infections in China, underscoring how interconnected our world remains and how quickly viral changes in one region can influence the situation in another. In the United States, NB.1.8.1 was identified at several major airports, including those in California, Washington State, Virginia, and the greater New York City area. These findings highlight the importance of continuous surveillance, especially at points of high international mobility, so that health officials can monitor evolving risks and respond swiftly to new threats. As genomes are sequenced and patterns tracked, the hope is that early identification will enable targeted containment efforts, keeping potential surges localized rather than allowing widespread outbreaks. Elsewhere, parts of Asia are seeing their own battles with surges in COVID-19 cases. In Hong Kong, for instance, infection rates have sharply increased, with weekly case numbers jumping from just over 30 at the beginning of March to well over 1,000 by mid-May. In that same period, the COVID-19 positivity rate doubled, and hospital systems began reporting a measurable uptick in cases rated as severe, as well as a rise in deaths. For a region that has endured multiple waves of the pandemic, this latest resurgence has prompted renewed public health alerts. Authorities in Hong Kong, as in many other places, are urging their most vulnerable residents to seek out an additional vaccine dose as a critical means of protecting themselves. There is also a strong emphasis on maintaining rigorous hygiene practices, such as hand washing, wearing masks in high-risk settings, and isolating when symptomatic. In Singapore and Thailand, public health protocols have been carefully updated, often shifting towards symptom-based isolation in an effort to balance prevention with the need for social and economic normalcy. At the heart of the ongoing public health response is the continued evolution of vaccination strategy. On May 22, 2025, vaccine policy in the United States took another step forward when an FDA advisory panel, with unanimous support from its members, recommended that vaccine formulations for the upcoming 2025-26 season be tailored to target the most current strains, particularly the LP.8.1 strain, which now accounts for nearly 70% of U.S. COVID-19 cases. This recommendation does not emerge in a vacuum. Under the new leadership at the FDA, the scrutiny of vaccine policy has sharpened, raising the bar for evidence, safety, and cost-effectiveness. With stronger regulatory requirements, manufacturers face increased challenges in updating vaccines, not only to maintain pace with viral mutations, but also to manage the cost and complexity of large-scale production. It was in this context that the advisory panel offered a word of caution. While it is critical to keep vaccines current, they recommended against updating vaccine composition more than once a year in order to avoid overwhelming logistics and manufacturing systems. Globally, the World Health Organization continues to play a central role in offering guidance. The latest advice from the WHO is to use monovalent vaccines based on JN.1 or KP.2, which remain suitable for widespread use. However, the LP.8.1 strain has also been recognized as a strong alternative antigen. These recommendations are designed to provide flexibility in national vaccine programs, ensuring the selection of vaccine compositions that best address local epidemiological realities. It's not just vaccines that are evolving. Our understanding of COVID-19 treatment continues to progress as well. Recent publications have drawn attention to the promise of Janus kinase inhibitors, or JAK inhibitors, as a preferred treatment option for many hospitalized patients. Drawing from nearly 13,000 participants in 16 randomized trials, researchers have shown that the use of JAK inhibitors, such as Pfizer's Xeljanz, Eli Lilly's Olumiant, and AbbVie's Rinvoq, can reduce the risk of death within 28 days by an impressive 33% compared with other commonly used treatments, including dexamethasone and IL-6 blockers. These drugs now stand poised to reshape global clinical guidelines, offering new hope for patients across vaccination statuses and regions. All of these advances and adaptations have happened against a backdrop of important policy progress at the international level. On May 20, 2025, the World Health Organization announced the formal adoption of a new pandemic agreement by its member states. This landmark agreement, the result of over 3 years of intense negotiations, is intended to secure a foundation for future global health cooperation. Its adoption highlights 2 essential lessons of the COVID-19 era. First, that no single nation can tackle a pandemic alone, and second, that global solidarity and equity are prerequisites for a safer, healthier world. Under this agreement, nations have pledged to share information quickly, coordinate resource allocation, and prioritize access to medical countermeasures, ensuring that no region or population is left behind in the global response. As we reflect on these developments, it becomes clear that the COVID-19 pandemic, even after several years, still poses ongoing challenges. The emergence of variants such as NB 1.8.1 demonstrates how quickly the situation can change. Continuing vigilance is required, not just from scientists and policymakers, but from communities and individuals around the world. Decisions on vaccination need frequent review, medical treatments continue to be guided by the latest research, and international cooperation will be vital in addressing this and future pandemics. In conclusion, the current global COVID-19 situation exemplifies what it means to live alongside an evolving health threat. Through collective vigilance, regular updates to vaccination and treatment protocols, and, most critically, international cooperation, we are better equipped to respond to both the ongoing pandemic and to future challenges that may arise. The shared commitment shown through the new WHO pandemic agreement is a testament to the enduring belief that, together, we can build a more resilient and equitable world for all.